Health Cabinet Secretary Susan Nakhumicha is asking medics to abandon their strike and return to the negotiating table. The CS says the government is committed to end the health impasse that has seen paralysis in the health sector. Nakhumicha, while speaking in Kajiado County today, expressed hope that the stalemate would end this week. But as Husna Mohammed reports, medics remained adamant in their demands today, holding peaceful protests around the city of Nairobi.
34 days are still going. Unhappy medics held peaceful march on the streets of Nairobi, defying Inspector General of Police Japheth Koome, who had outlawed the protest. The doctors maintained their hard stance of not going back to work if the demands are not met by the government.
They are on the street because there's a swelling disillusionment in the hospitals. That when they go there, their work only is to confirm that a patient has died. And this is happening because there's a big shortage of doctors, there's a big shortage of health workers across the country.
The striking medics accused the government of failing to listen to their demands. They claimed that the government had run away from the negotiating table.
It is not right that you demand for allocation of funds to the counties to build hospitals, to get kickbacks, but you have no regard to the healthcare workers who offer services in those facilities.
Just today, the Health CS, Susan Nakhumicha, was speaking in Kajiado County, asked the striking doctors to return to the table. She said the government was ready to listen to them.
I want to ask of them that the government has extended an olive branch. The government has given them an offer. It is up to them to come to the table and we discuss their counter offer.
Earlier, the Council of Governors Chairperson Anne Waiguru implored upon medics to end their strike, saying the demands are unrealistic and could dent the economy if implemented.
This would have a ripple effect on all civil servants' basic pay and will therefore require additional allocation of resources to county governments to be able to carry out this task.
Meanwhile, unposted medical interns have dismissed what the government is offering them. They say the 70,000 Kenya shillings before tax is too little.
They work more than 100 hours a week and they are not paid, yet the patients pay money for the services. We are also demanding that they are paid, they are remunerated.
Contrary to expectations, today's medics' protest march was peaceful and without incident. The Inspector General of Police Japheth Koome had said the march was illegal, but following his announcement, a section of civil society groups, including Kenya Human Rights Commission, have now sued the Inspector General over his statement terming his declaration illegal and unconstitutional.
April 16th marks day 34 of the doctors' nationwide strike, day 16 of the clinical officers, and day 15th of the medical laboratory officers. As usual, when two elephants fight, is the grass that suffers. Kenyans continue to struggle and be deprived of essential services. Husna Mohammed, KTN News, Nairobi.
The latest report by Auditor General Nancy Kadhongo on Kiambu